Dr. Blair, I just love learning from you. Tell me, I'm gobsmacked that you said this. We need meditation. We need it.
Well, we need relaxation. We need a calming effect. We need a focus on mindfulness.
Welcome to Season 5 of the Cannabis Truth podcast. Your host is Honey Smith Walls, author of the new book, Healing Beyond High, Cannabis Truth, a gentle, practical guide for elders to learn cannabis fundamentals safely and effectively without overuse or overwhelm. In a world where the FDA has yet to stamp its approval on this ancient natural remedy, Honey Smith Walls bridges the gap between Western healthcare norms, uplifting benefits and relief through gentle cannabis plant therapies. Join this 21st century cannabis shaman, uniquely positioned to assess the green intentions of medical, farming, and business industries in cannabis and uncover fascinating historical, political, scientific, and spiritual facets of the plant.
Hi, how are you?
I'm doing very well, thank you.
Oh, I'm so glad to hear it, and I'm just delighted that you're here with us today. Thank you so much for gracing my show, the Cannabis Truth podcast, and of course, all my audience knows what a huge fan I am of yours and how much your product has made a difference, a huge change in my life. So I'm just delighted that you're here so that we can chat about it.
Honey, it's a pleasure to be with you and you're on your podcast. I welcome the opportunity. We've talked many times, but I appreciated you getting the professional recommendations, and I can speak to any questions that you have, and I would love to elaborate on all the topics that I know about.
Great. Let's start early on, if we may. Didn't you go to a very important school in your youth?
Oh, are you talking about my West Point experience?
I am.
So when I was 17, I left for New York from Florida, and I joined the United States Military Academy, spent 4 years in there, and graduated in 1972 as a combat officer.
That's amazing. From combat officer to doctor. How did that happen?
Well, I actually applied for medical school during my junior year at West Point, and I was accepted. And I was thrilled, but I was also panicking because I knew that it was dependent on them releasing me to go to graduate school to go into the program. And I was denied. They only allowed 12 officers, 12 graduates to go directly to graduate school for medicine, for medicine. And I didn't make the cut. I wasn't high enough in my class to qualify. And so I had, oh my God, this is terrible. And so I resubmitted for 2 years, and I finally got released in my second year after I was serving in the artillery for 2 years. And I was in Fort Lewis, Washington, and I accepted the offer, and I joined medical school in 1974 after 2 years of waiting and 2 years of graduation. But I was sweating it the whole time. It's always been a passion of mine since high school. I really wanted to go into medicine, and as it happens, most of my family, well, some of my family was in my medicine. My mother was a dietitian. And she had extensive experience. And my sisters, one sister was a nurse, and another sister became a psychologist. So we had kind of a family orientation towards this profession in some way or the other. But I had to one up them all and become a physician.
I bet the conversations around the dinner table were fascinating.
They certainly were.
I have,
and they still are.
I'm sure. So I've been reading a lot about a particular terpene, Can you explain to us how you came to find the one that I'm so crazy about? I know you're passionate about, but it came to us through cannabis, didn't it?
Well, it did. In 2014, I joined a company that was producing one of the early marketable products, CBD products, cannabidiol products. I joined them, and at first I was brought of interest, and I was exploring the science on it. And I got some samples. I started using it, and then he offered me a job in counseling patients who were using the cannabidiol. And I started talking to them on the phone and advising them how to use it and what to use it for. And I really cut my teeth on and learned about cannabis that way. It was a broad spectrum and a full spectrum CBD product. But early on in that phase, I was connected to a chiropractor who was very interested in using caryophyllene as a cannabinoid substance for the treatment of dog cancers. And from there, I sort of was working around the raw product. I got some copaiba oil from South America. I
Mhm.
started experimenting with it in terms of topical applications. I found it was a fabulous analgesic topically. And then I found another source that was less expensive and it was more purified. And so I started using that. And as it happened, I learned about the different aspects of it, the analgesic properties, the particular anti-inflammatory properties. I explored the antioxidant properties of it. I was amazed at the potential for this product. And then I had a patient who was having retinopathy, and he had a severe retinopathy. He had macular degeneration. He had a diabetic retinopathy, and he had a sensitivity and an ocular nerve destruction and damage from an immunologic phenomena. And I started treating him. Ironically, I started using a vaporized form of beta-caryophyllene on him, and I saw a magnificent recovery. And so I was really excited about that. And I did a case study and I reported on that, but nobody seemed to be interested. And so I, for the last 2 years that I was with the company, I begged the company to produce a product that would capitalize on the beta-caryophyllene, and they wouldn't do it. They absolutely refused. So I had to have it done myself. And when I did, I just discovered a huge number of benefits from it that I was not totally expecting. And I was amazed at the different properties that it offered. And I was stunned in terms of the benefits of it.
Well, I am too. And did you say part of that condition was macular degeneration?
Yes. It
I,
effectively blocks macular degeneration by blocking all the inflammatory mechanisms that are involved with macular degeneration. And so it blocks TNF alpha. It actually blocks the VEGF, the one of the primary antibodies that you get injected into the eye is a VEGF product, and it actually blocks that production. And what that happens with that hormone, that substance is it's a cytokine, and it's released and it forms vascular networks on top of the eye, and that extinguishes the visual effect on it. But then I also found that it actually improved people's vision. The people who were having difficulty with their eyesight. And I also discovered that it was effective for glaucoma. It relieved the pressure on the eye and marvelously. And so I was getting a number of people who actually improved their vision. They resolved their macular degeneration, at least significantly, so that they reduced the number of shots they were getting. And I was having a fabulous result with that. So I switched from the vaporized form to an oral form when I had my product developed. And my product was more effective than that because it was liposomal. And in liposomes, It's a phosphatidylcholine wrapped beta-caryophyllene, and by wrapping it that's the natural way that the body absorbs different substances through these these little bubbles that they're produced, and so that enhanced the bioavailability like 10 times the normal amount that you would get by taking the oil directly. And so I
Like,
saw the fabulous results.
is that like putting a little drip of beta-caryophyllene in a Cheerio so that it goes into your system better?
That's okay. I'll take that.
Okay, that's how I see it, as as I understand it, as I can visualize it, just so that your body absorbs it better, because it doesn't absorb the beta-caryophyllene as well as it does the liposomal form, right?
Right. So the liposomal form is just a bubble that has a membrane, an artificial membrane around it. And because of that membrane, that's the way the body normally absorbs things through vesicles, and it invaginates them and it absorbs them through the cell wall. And this spoke to that exactly, and it enhanced the absorption.
Wow, that's fascinating. Every old, pardon my language, every old fart I know that has macular degeneration becomes sort of an expert in that field. And I know that several of them have been trying CBD to help them, and cannabinoids. And it seems like they always get a warning about using, cannabinoids because of it, it raising the pressure a little bit, but then it seems to go back down. But there's
Mhm.
always that fluctuation, and it's fearful, for them for
So
any kind of.
CBD does actually increase the optical, potentially increase the optical pressure on the eye, whereas THC actually relieves the optical pressure on the eye. So that's been what's been touted about, is being using THC to reduce the ocular pressure. But beta-caryophyllene does it directly, and it does it highly effectively within a month.
That's what I was shooting at. So, are we getting it across to ophthalmologists and all those eye doctors and so?
No, they're
Oh,
not interested. In fact, I've talked to a number of different eye doctors and retinologists in particular, and they're only interested in giving shots. They're not interested in the science.
why is that? How have we conditioned them to be so pig-headed?
It's money. They
Is
make
it?
several $1,000s per shot.
Oh, oh, oh. Wow. Okay. Well, there it is, folks. I'm, this is not the first situation that is distressing for us as patients, because we can't get the care that we really need because of the money thing, or
Mm.
whatever the reasons are. Congratulations on going global. I know that you're in the European countries now, and Australia too, and I'm really proud for that, well, because I'm
Well, we've got a
right there
product
with
in
you
Europe
about this.
that is made with hemp oil and beta-caryophyllene. The combination is a perfect combination of omega fats. So it's got a 1 to 2 ratio of omega 3s to omega 6s, which is sort of the ideal form of the right ideal balance of omega 3s to omega 6. Plus, it has other benefits, and it's highly bioavailable as well in the omega 3s. And it has a number of polyphenols that are associated with the phenol oil. So it's got a full spectrum of phytocannabinoid, well, of flavonoids and
Oh,
polyphenols, but it has no CBD and no THC. But it's mixed with a concentration of beta-caryophyllene that has been magnificent in terms of its relief of a number of symptoms of back pain, and even a pre-malignant lesion that was going on in this guy's back that was related to a autoimmune disease. So he's having great results. He's working with me now, promoting it among the psychology community as well, to get it out there for for complex post-traumatic stress disorder because it's been so positive in that respect. In Australia, I've sent it to a number of people in Australia. I've got several people who are using it for topically, the gel topically, and topical beta-caryophyllene. And I've been promoting it there, but I only have it in a few isolated locations that's actually being produced and is being distributed in New Zealand and Australia.
Fantastic. Well, I tried to order samples the other day and you were out. So I understand now why everybody's ordering samples from you to take to everybody else. Listen, I do want to talk to you about autism. And, you know, I heard you say that this has been really helpful. And I was wondering if Dr. Bonnie Goldstein has picked up on this for her autistic patients and all of that. I'm just so hoping for new medications to be able to relieve, you know, the issues involved in kids and adults.
Been in contact with Bonnie, and she's got the product and she's testing it out. They're going to determine whether it's going to be beneficial for her patients, and so she's testing it right now. But I'm not sure who she's testing it on. If she's testing it on epilepsy or autism, and I leave that to her and make her decisions on that. But it can be effective in both. Now, for epilepsy, you have to use fairly high doses because the requirement and the studies that have been done in animals have shown that it does require an extra special amount of BCP. But in autism, just a very small amount can have a great deal of anxiety reduction for autism. You know, there's abnormalities in the CB2 receptors in autistics. And if you can connect those receptors up with a vigorous antigen, agent like beta-caryophyllene that activates that receptor, then you could correct for a lot of the behavioral abnormalities that go along with, and particular anxiety, and then there are repetitive motion types of things. So I've actually had a couple cases where kids were very anxious and worried, and they were upset. When they got a dose, then they would calm down completely and relax and be and stop the stemming, sort of the repeated behavior that they were going through. Plus, you know, CBD can be very effective for autism as well. But it reaches a point where when they are maturing, about in adolescence, that it may not become as effective as previously. And that's when beta-caryophyllene can really take hold and cause a real change in their aggressive attitude and their aggressiveness, and they'll be able to concentrate better on the things that they need to do. And I theorize that it actually improves their socialization as well. One of the factors that beta-caryophyllene has is a socializing impulse that goes on with it, so that there's more communication, there's more sensitivity, there is more caring about the other individuals that are in the room, and it improves the neurogenic receptivity for individuals so that they can connect better with their environment. So I think it has a huge potential, and I don't know what the best combination with is. Is it alone or is it with CBD? But I think that it could be a major factor in even rectifying much of the autism at early stages of the disease and getting people back on track for their full cognitive function. And I would see that for not only autism, but for Down syndrome as well. Down syndrome is particularly susceptible to different behavioral abnormalities, and it remains to be an inflammatory condition of the brain, whereas beta-caryophyllene stops that inflammation and can correct for some of the complications cognitively for for Down syndrome. One in particular is the benefits of beta-caryophyllene has to do with its formation of neuritogenesis and neurogenesis. So it actually stimulates neurogenesis and making of more nerve cells, and more neuritogenesis, which is the axons and the dendrites that connect up to our memory function and our global function, amounting to a neurogenic plasticity that needs to be there. And that neuroplasticity is key and important in depression, in anxiety, and in other behavioral disorders where the hormone, the stimulations are depleted, and beta-caryophyllene can come in and stimulate that sort of benefit on everybody, and including dementia cases as well as the cases of Down syndrome. You know, I treated a case of Down syndrome several years ago, and I did it by a topical application of CBD and beta-caryophyllene. I used it topically. Now, it was unique in that I formulated it myself out of a standard cream and gel that we were just off the shelf. And I mixed it. I sent it to the couple. They were in Newfoundland, and I sent it to the couple from Victoria, BC. Because I didn't want to have to go through customs on it,
Right.
I sent it to them, and they put it on there. And after 1 week, she was becoming very agitated, and she actually had threatened her sister by pushing her down the stairs, but she didn't actually execute that. But when she got this cream and put it on, within a week, she calmed down completely, and she was very compliant, very cooperative, and lived another 10 years. But what I wanted to point out is that Alzheimer's disease is very, very common in Down syndrome. It's a common exit strategy, or common exit for the geriatric of Down syndrome, so that they get it early and they get it very intensely.
I had no idea. I'd never heard that before, and it's so alarming. And yet so hopeful, knowing how beta-caryophyllene works on all of that. Oh my gosh. I have friends who work with adult spectrum, and they're seriously agitated, and they're on a handful of drugs, and it's a terrible job.
Mm-hmm.
Or somebody to be basically a monitor over somebody with this.
And that's so important, because you get the caretakers are suffering much of the sleep loss, the anxiety, and the depression that they encompass as a caregiver. And so I frequently will recommend the treatment of beta-caryophyllene for those individuals, as well as for the patient, to control their agitation as well.
I'm so glad to hear that, because I sent a sample to one of those caretakers, and he reported that it helped him tremendously just settle his angst down, and that constant stress of living in fear around volatile patients.
That's one of the key factors for beta-caryophyllene, is it actually stimulates the parasympathetic nerves in a very positive way, so that it relieves stress. As a matter of fact, it blocks the release of cortisol and the stimulating effect of cortisol from the brain, and epinephrine. So it blocks that flight or flight phenomena that occurs with anxiety. And so it can relieve stress in a major way. And that's probably one of the reasons why it enhances sleep quality.
I don't doubt that a bit. I was having a terrible time trying to sleep before I met you and understood your product and tried it. And neuropathy in my hands just kept waking me every hour on the hour. But something new happened to me as well. I began having this sort of spasming bladder issue that would awaken me and make me jump up and run to the bathroom in the middle of the night several times a night. That was new. And first time I took beta-caryophyllene, well, BC Plus, that was just over. Hasn't happened. I sleep all night long now with at least I don't know, maybe six full hours of sleep because my hands aren't waking me every night. They haven't stopped hurting
And your
completely.
bladder has calmed down.
And my bladder has calmed down. But look, I'm still making a fist, which is not, this doesn't happen if I don't take BCP. This doesn't even happen with cannabis. And much as I love cannabis and still use it throughout my day, I don't want to live without beta-caryophyllene. And I really want to try it with um, CBD to see, how that would manage
Oh,
some of the. Yeah.
2 points. Now, one, we'll talk about CBD in a moment, but what I wanted to tell you was I think I've discovered the connection with smooth muscle and muscle relaxation in it. So when you take BCP, you get immediate effects of relaxation. You get calming, relaxing effects. Your muscles relax, your hand gets a
Yep.
full range of motion because the muscles and the tension in the muscles relax, but you feel a relaxation all over your body. And it goes for smooth muscle, the muscle of your bladder and your intestines, as well as skeletal muscles. So this is phenomenal. And how does this happen so quickly? And the only explanation I can come to is that it actually inhibits the calcium and potassium ion channels at the muscle level. And it happens so quickly by inhibiting those that prevents the tension and the contractile nature of those muscles. And so they relax, they calm down. And you don't get the spasm, you don't get the irritability from those muscles, and you get an increased range of motion wherever the joint is. Or wherever the organ is. For instance, gallbladder. I've had it relieve gallbladder pain in particular for individuals, and it relieves gut pain as well from cramping and stuff like that. And bladder, that's fabulous, and you have all these benefits. Plus, it relaxes smooth muscle in vessels, blood vessels, to enhance blood pressure control. And so it corrects for high blood pressure in many cases.
This is it's it's just like the little miracle worker, isn't it? It really is.
I'm afraid to say all these things
I
online
know.
because it sounds like snake oil.
It does.
And
It sounds like quackery,
I would have
but
thought
it's
it was snake
not.
oil if anybody had told me about it like this. But I've amassed all these case studies and all of this experience and clinical experience. And you can tell I'm pretty sincere in what I'm expressing. And these are absolutely positive experiences that I've gone through, but none of it has caused any adverse effects. I've seen no adverse irritation from using beta-caryophyllene.
No toxicity whatsoever.
No, no. And now with CBD, it can be highly effective. They act synergistically. Now, there's CBD connects with a plethora of different signaling molecules, and it signals the body in a number of ways. But BCP does the same thing, but they tend to overlap, but there's some unique aspects of both of them. Now, CBD connects very loosely with the CB2 receptor, although that's the major benefit for much of the interactions that go along with CBD. But beta-caryophyllene is a very strong activator of the CB2 receptor. And so I think that's where a key point. Now, the other area that they tend to overlap are on the PPAR receptors. The PPAR are nuclear receptors that orchestrate a cascade of metabolic and immunologic effects. Whereas CBD works on the PPAR gamma, then beta-caryophyllene works on PPAR alpha and gamma. So it works on both of them for a magnificent metabolic effect and immunologic effect and pain relief effect.
Would any of this knowledge be available or make any sense without having understood the ECS, the endocannabinoid system?
Oh, no, no, no. This is paramount to understanding the interactions, but it's so confusing and it's so unappreciated what the CB2 receptor can do. So for the most part, the CB2 receptor has been delegated to, oh yeah, it's there, but it's not that important sort of thing.
Okay.
And it's talked about in the old literature as being all in the periphery. Well, that's bullshit because it's located through every organ, every sub-brain system. It's located in the amygdala. It's hypothalamus, the brainstem, the medulla. It's in the prefrontal cortex. It's located everywhere. And one of the key areas is in the midbrain that houses the ventral tegmental area that controls addiction. And so it actually controls addiction, and it blocks the addictive pathway by combining with CB2 receptor and the PPAR gamma receptor. And those two in combination defeat and subdue the dopamine release that goes to the other brain centers, the nucleus accumbens and the prefrontal cortex, and they control completely addictive components of everything. That means alcohol, that means THC, that means cannabinoids, nicotine,
sugar, caffeine, any of it.
All of it, and foods too. There's an addiction to foods as well, typically carbohydrates, that is very paramount in our obesity epidemic, and it blocks that addictive pathway. So it has amazing different connections. But I want to get back to the CB2 receptor. So the CB2 receptor is located throughout the brain. It's just not as popular. It's not as pronounced in terms of numbers as the CB1 receptors, which are all over the place in the brain. But the CB2 receptors only are really prevalent in large numbers when there is inflammation in the brain. Otherwise, they take a low level of involvement. Plus, they're located in the immune cells of the brain, but they're also in the vascular cells, the neurons and the dendrites and the axons of the brain cells as well. And it's totally unappreciated and totally ignored by most of the literature.
Oh my gosh. Oh my gosh. It's disturbing to hear that it's ignored, that the information is out there, but it's ignored.
Well, hello, I'm Dr. Philip Blair, and I want to introduce you to Honey Smith Walls. And she recently had an experience with beta-caryophyllene. How's your sleep?
After 7 or 8 days of a seriously healthy 6 to 7 hours of sleep, unbroken sleep, which I hadn't had in way more than a year. That first night when I slept all night, didn't even get up to go to the powder room, and none of my dogs, I have 5 dogs that sleep in this bed with me. None of them awakened me. And it's been the same one night got real busy outside, must have been a raccoon or something. But, that would ordinarily really tick me off because my sleep was so precious. But because I've been getting good sleep with BC Plus, God, 6 to 7 hours at my age, that's just amazing. Does it have a shelf life like cannabis does?
It's at least 2 years because it's antioxidant. I believe that it is protected from most of the oxidation. And if it does get oxidized, it turns into another active compound, beta-caryophyllene oxide, which has a number of properties of itself.
I was going to ask you if it devolves into something else like cannabinoids can, like THC to 11-hydroxy or whatever. Also, I love these little factoids that I keep learning from you. The ECS is the endocannabinoid system, is the 12th body system. I didn't even know we had more than one or two. I must have missed that day in high school.
Well, they never talk about them in the group. And so we've put together, as we've identified the endocannabinoid system as a separate system, then we want to contrast that with the other systems of the body. And we wanted to emphasize that it is a master regulator for these other systems. And it does so by orchestrating what I consider a software communication between these other systems, where if there is an irritation to the gut, then that's going to send up a signal through the endocannabinoid system, and the endocannabinoid system is going to correct for that by releasing endocannabinoids or orchestrating an enzyme that is going to help resolve that problem, or promoting a bacterial in prevention of the microbiome that's involved with it. And so it has this software, this sort of interactive component that's communicating with the inside and the outside of the body. And so I take it up, and it's a master controller, so it's kind of orchestrating all these systems, whether it's the renal system or the immunologic system or the nerve system. It's communicating with all these systems and is playing a major role in adjusting to establish homeostasis. And so with homeostasis, we just want to be normal. We just want to have a normal function and normal activities and normal cognition, and a normal exercise potential. And what the endocannabinoid system does is facilitate that normalcy in the body. And so that's the key factor for the endocannabinoid system as a master regulator of the body. But you can, and much of the lifestyle changes that we incorporate have a lot to do with the endocannabinoid system. We need exercise, we need sleep, we need meditation and rest. We need dietary concerns, and there's diets that have to go through. And you get other different things that you need to have supplied to you. You need definitely have different types of rest modes that you can get into. But all of these things play an important part in relieving our stress for our bodies that leads to inflammation, and the disruption for different types of medical problems that we encounter, such that almost all chronic diseases are a result of endocannabinoid dysfunction. So the 12th body system is supposed to be orchestrating all those corrections for those chronic illnesses, but it can't unless we're employing the right lifestyle changes to the body.
Dr. Blair, I just love learning from you. Tell me, I'm gobsmacked that you said this. We need meditation. We need it.
Well, we need relaxation. We need a calming effect. We need a focus on mindfulness, and that's where we got to have our emphasis. Otherwise, we're attention deficit. We're working in many different areas. We're creating anxiety and fight or flight symptoms. You're promoting adrenaline, epinephrine, and you're promoting cortisol, and it's flooding the system, and it's creating psychological disturbance through an immunologic and neurologic phenomena. So we've got to keep these things calm and focused, and avoid the exacerbation and the flooding of our bodies with increased stress that's going to lead to this inflammatory signaling.
And I bet people don't realize how stressful all that social media and TV and all of that stuff is to them. I just found meditation recently, last few years, and didn't realize how stressed and anxious I was. Me? Stressed? What's that? And of course I was. And as soon as I was able to let go of all of that, I don't listen to the news anymore. I get it from a friend who's dying to tell me. I can't even watch it through Stephen Colbert anymore.
Only if they interpret it correctly, though.
Yeah, right. So, and that's all subjective too. So I'm very cautious about what comes in anymore. I so prefer listening to you than that stuff that causes me stress. What I learn by hanging out with these doctors and scientists whom, I've become friends with over the years in the cannabis industry is that what you just said, meditation, is truly important, but I didn't realize that we need it as part of our balance as a human, that we medically need it as part of our balance as a human.
Well, meditation is a tool that we can use to incorporate mindfulness and a focus on what our purpose is, and our relaxation and calming of our mental networks. You don't have to do meditation. You can just use mindfulness. You can use a number of other techniques as well, but you need to incorporate some sort of mindful training to establish a relaxed mental status as well.
I love that. Thank you for that advice. It's just glorious to hear a doctor say that out loud, and because usually it's only a pastor or, somebody in the woo-woo channels that are doing that, and it's so needed. We need this kind of advice so that we'll find the discipline to help ourselves become in a more peaceful, better state than what we generally live in, which is stressful. It's stressful. So just trying to navigate a human body is stressful.
And one of the biggest stresses that we encounter right now are lack of sleep. If we get our sleep disrupted significantly, then we create an inflamed situation in our brain in particular. We don't allow the brain to clear out its waste products out of the cells. Those are released into the lymphatics, the lymph system of the brain, and they're disposed of in that way during deep sleep. So if we're not getting our deep sleep, if we're running ragged and we're not getting the proper amount of sleep pattern, then we're going to be faced with a chronic inflammation of the brain, actually, from poor sleep.
It's like defragging your computer, isn't it? You need sleep to defrag.
And one of the beauties of beta-caryophyllene is that it puts you in that deep sleep category right away. Now, I've been charting my sleep patterns for the last year with a special ring that kind of measures my sleep patterns, and I'm getting between 22 and 20, actually 30% deep sleep each time I sleep through the night. And with that deep sleep, I know that I'm getting an excellent recovery, and I'm getting a resolution of different stressful patterns in my brain. And I hope that I can keep it clean and preserve it from the trauma that I've experienced in my life. But the main point is that it's going to help with deep sleep, but it's also going to modulate the other sleep factors, and it's going to increase the duration of sleep, as well as the depth of sleep for each person. Now, when you take beta-caryophyllene for sleep, you may need to avoid right before sleep because it can be activating. And with this activation, you tend not to want to go to sleep. Whereas if you are using it a few hours before you go to sleep, then you're not going to be so activated and you're going to sleep with greater depth. So I tell people when they're first using it to determine if it's going to be a highly activating substance and to avoid it right before sleep. But some people, like myself, I can take it right before sleep. I'll clunk out and I'll go into deep sleep phase with an excellent sleep as a result.
I'm going to try that tonight. Yeah, because I would like to get right into that deep sleep, and there's a moment just before that deep sleep where it feels like I'm falling, and it's a luxurious fall into the depths of that sleep, and I miss that. But I'm going to try a little BCP right before bed tonight and see if that won't happen.
Now, one of the factors it can during the early phases of using BCP, it can enhance your dream state. So they tend to be very colorful and very vivid dreams, and that can be disturbing for some people. But they're not nightmares; they're just vivid dreams that can happen with BCP.
Well, I haven't had dreams in years because I guess I've been taking a lot of THC that just kind of does away with that for me. Along with any negative looping, thoughts that are going on. So, And I have to say, I've missed my dreams because I have some whoppers, but maybe if I back off of the THC, that'll return to me because I like dreaming. And right now, I have to resign that to my daytime dreaming. Hey, is the ECS an organ?
No, it's a system.
It's a
It
system.
permeates the entire body, and because it permeates, it's in our skin, it's in our brain, it's in our all of our organs. And so, being comprising all of our organ systems, it represents a system, just like your neurologic system, just like your immunologic system. It's not confined to any one area. There's plenty of receptors in our many of our organs, particularly in our secretory organs, our endocrine organs. There's connection there. That's in the pancreas. It's in the liver. It's in the kidney. They're really all over the place for the body, and they can produce anandamide, which is one of the chemicals of the endocannabinoid system, and 2-AG for most part. And it's located in our sexual glands as well, our ovaries and our testes, and it plays an important role in fertility as well.
Oh yeah, I heard that, and also that your breast milk expresses anandamide.
Yeah, it's one of the healing and beneficial substances in breast milk. And so children who are properly, mothers who are lactating and are producing natural, are getting good sources for their food, omega-3s, they're actually producing some anandamide, and it's going to be secreted into the breast. And it's probably why there's a calming effect for breast milk when the babies take it.
Did I hear you say that beta-caryophyllene is in breast milk too, and in whole milk?
I did. That's beside the endocannabinoid system.
Yeah.
Beta-caryophyllene is found significantly in grass-fed animals, and particularly cows, and it's produced in milk significantly. And depending on their location and their sources for it, they can get some significant amounts of beta-caryophyllene in their milk, and then you can drink that, and you can get those benefits as well.
Yes, you can. God, that's interesting. Gosh, I just love that we have so much ability to help our babies, when they're first coming into the world.
If you take beta-caryophyllene orally, if you are lactating, you will secrete a significant amount of beta-caryophyllene in your milk. But I point out that it's naturally found in milk, in cow's milk. And if a woman is drinking cow's milk, then she's going to be expressing beta-caryophyllene. And it's going to be found in a number of different fruits and vegetables. And so you're going to be getting caryophyllene. So I don't believe there's any evidence of any type of problem associated with beta-caryophyllene in infants. Now, I've used it in a 3-year-old with a atopic dermatitis and allergies, and it's been very, very effective for the allergic phenomena that goes on with that, and it relieved the child's anxiety to a great degree as well. I don't think that it has not shown any difficulty in adolescence either, or any age group. So I think, and the studies have examined it for adolescent animals. And I say that animals because there's only been 10 human studies on the use of beta-caryophyllene. But in animals, fetal animals, there's been no deviation from normal fetal development and normal gestation with beta-caryophyllene use in animals. And it is I don't know if there's a particular benefit for using it in pregnancy. But it does have it's found naturally in many foods. And so you're getting a dose of it anyway. And so if you up the dose, I don't believe that there'd be any type of problem associated with it.
I can tell you lots of reasons for a pregnant woman to take beta-caryophyllene, beginning with if she had any addictions before pregnancy, like nicotine or, drug use or whatever, that would settle it down, give her, anxiety relief. And especially if somebody's having a hard pregnancy, that I would think the relief from anxiety of all of those issues, hormones of pregnant mothers, oh my Lord. So hormones of
Well,
women,
I think
oh
it
my,
would be highly effective in postpartum depression
oh
as
yes.
well, because of its natural ability to relieve depression immediately. Then I could see it in a hormonal depression that occurs so commonly in women, and they suffer through that, and they've got totally inadequate therapy right now in terms of the SSRIs and the antidepressants that take weeks to work, and they're marginally effective. Now, I'm not telling people to take BCP during pregnancy.
Either.
I definitely want to make sure that's clear that I'm not promoting it for that purpose.
Right. But I can't wait until somebody figures it out, because it just seems so appropriate, with no toxicity, with the ability to relax skeletal muscles and soft muscle tissue, like you said. Holy cow, what do you think's going on in there? While trying to shove another human being out of your what. So it just seems like it's the right thing. There was a lot.
I've evaluated this in a number of women, and they have asked me about using cannabidiol for pregnancy, and if a woman is suffering with pain and anxiety and suffering greatly, and they're normally going to be using another pharmaceutical drug, then that pharmaceutical drug needs to be evaluated. And there's questions about those. So why not they could use a cannabinoid to help them with these ill feelings and rectify their illness without any significant additional risk from using it. So I've argued the comparison, not that you're going to use cannabis or not use cannabis, but more that you're going to use cannabis or you're going to use another drug and compare it to that other drug in terms of its effectiveness and the potential for interactions. We know now that Tylenol is adverse and may promote autism in young children.
You knew that. I didn't. Oh my goodness. So, oh my goodness. Well, that just stopped me dead in my tracks, because so many people use that product, and just pop it like it's candy
Right.
for all kinds of.
And it's considered absolutely safe, but in fact, there has been a correlation with autism in some cases.
Oh my goodness. Oh my goodness. We still have so much to talk about, but I appreciate your time so much, Dr. Blair. You're such a hero to all of us for bringing this forward and for helping us try to understand how to take care of ourselves. The information out there, especially for women, is just incredibly frustrating. And I'm getting ready to go talk to more of my own physicians about medication and switching over to less harmful compounds that do me so much better. And I see resistance. Well, what are you bringing this in here? What do you want me to do with this?
Well, maybe we can talk about women's issues next time we speak. I can talk about the endometriosis. I can talk about menopause. I can talk about migraine headaches. I can talk about bladder spasms that go on with people as well, and gallbladder disease at the same time. And we can talk about mast cell activation that occurs in about 80% in 80 women in 80% of the cases. Which is a terrible affliction that most women don't even know that they have it, and they are facing these difficult problems with it. And
Right.
polycystic ovary disease as well.
Well, I was going to tell you about the book I was reading on menopause in women, but I can't remember the name of it. But it is a terribly distressing history of hormones and women. And I am just so hopeful that beta-caryophyllene and cannabinoid compounds will be a much better path of relief for me. I'm 70. I'm still on HRT, but not on estrogen. And I don't know why I'm not on estrogen yet, but
yeah, the latest literature has come out on estradiol being used in women, no matter what their age, and I highly endorse it. It prevents disease in 20% of cases.
Oh, thank you for telling me that. I just feel lost about my hormones.
So an estradiol patch would be ideal, and it would protect you. There's a 19% reduction in atherosclerosis, and there's a significant reduction in dementia, but it's going to clear up your brain as well. We're faced with a number of estrogen receptors throughout our body, not men, but women, and they're very, very functional, and you've got to get these incorporated, and the estrogen patch is the ideal way to do that, and it's been endorsed by major authorities at the present time.
Thank you so much for this counsel, because I just didn't know who to believe or trust after being frightened about it all my life. And now trying to research it on my own, thanks be to you. I'm so grateful to have your expertise in this area. And I'm getting ready to do a talk on stage about women after menopause and cannabis, of course.
You definitely need this information. I'll get that to you.
BC Plus. So yes, I do. And I'm so grateful that I can't wait to talk again with you about all of these women's issues. This will be a real eye-opener for women. And I so appreciate your help, Dr. Blair.
Thank you. You know, I really thrive on the appreciation that you offer me, and I know that I'm speaking to a very receptive audience in speaking with you.
Absolutely. Thank you so much. I'll let you go for right now, although I hate to. And if there's anything else that you'd like to tell us, like as in, for instance, how somebody can get in touch with you and where to find your BC Plus product. Of course, I tell them all the time, but you go ahead.
Well, I'm at blairmedicalgroup.com, and you can buy my products there. I've got 5 products right now that are available. There's a liposomal product. There's a gel that's a topical. There's a pure terpene blend that can be used as well. And then I've got crunches, which are little 1 centimeter cookies. And I've got capsules now. So the capsules are an immune blend that has magnificent benefits and can be taken twice a day. I offer advice and counseling. You should be able to find that on the website, but we also have a number of white papers that are available on the website. You can read all about inflammation, mast cell activation, and hopefully I'll have the metabolic, the presentation up there fairly shortly. If you really want to get in touch with me, I'm acceptable to emails. My email address is drblairmd@icloud.com.
Oh, thank you so much. That's very generous of you. And I really appreciate the time spent with us today. Thank you again, Dr. Blair. And we'll schedule another meet real soon and talk about all of those women's issues.
All right, great. Good to talk with you, honey. Take care.
Thank you so much.
You've been listening to another Cannabis Truth podcast with 21st century cannabis shaman, Honey Smith Walls. It is important to use verifiably safe products and look out for yourself while we're in this wild, wild west of cannabis right now. Ask for help. It can get complicated. If you need serious medical attention, please consult one of the specialists at cannabisclinicians.org. They will get you to the right person and therapy for your issues. Tune in here for weekly foundational knowledge and learn to determine the best choices and cannabis strategies for your issues. But please be advised that shamans are not doctors or scientists. You'll find those at cannabisclinicians.org. Unless otherwise proven by a reputable third-party lab test, please regard all street weed as contaminated. It may do grave harm to a patient with a delicate immune system who already has inflammatory issues like arthritis, IBS, fibromyalgia, or worse. Thank you for your time today.